This is At Home with ADTS, a show that presents topics of interest to older adults, individuals with disabilities, and their caregivers. At Home highlights the services and programs offered by Aging, Disability, and Transit Services of Rockingham County.
Welcome to this edition of At Home with ADTS, a program about supports and services offered by Aging, Disability, and Transit Services of Rockingham County. I'm Asheley Cooper, Director of Community Outreach and Development here at ADTS. ADTS has been in operation in Rockingham County since 1973. Our goal is to assist and link senior adults, people with disabilities, and their families with information, opportunities, and services that promote and enhance quality of life, as well as working to meet the local transportation needs of Rockingham County residents. We'd like to give a special thank you to our United Way of Rockingham County for their longtime support for our Meals on Wheels of Rockingham County program. United Way of Rockingham County brings together local people to help raise local dollars to meet local needs. And we thank everyone who's contributed over the years. According to AARP Caregiver Report in 2020, an estimated 41.8 million adults are caregivers. 75% report feeling a need for more help with information about caregiving. Today, we're going to discuss an online platform that is helping caregivers grow their knowledge and skill set. Our guest is Laura Jane Ward. She is the Relationship Manager with Trualta. Hi, Laura Jane.
Hello, good morning. Glad to be here.
Thank you. Glad to have you. Before we jump into what Trualta is, can you tell us a little bit about yourself and your role at Trualta?
Yes, thank you. I have been with Trualta for almost a year now. Prior to my time at Trualta, I worked for the North Carolina Department of Health and Human Services in the Family Caregiver Support Program. And prior to that, I worked at an area agency on aging with the Long-Term Care Ombudsman Program. And before that, what feels like a million years ago, I worked in a variety of roles in nursing homes. So my whole career has been in the aging field, and I'm currently a Master of Gerontology candidate through UNC Greensboro.
Wonderful. We're really excited to have someone so knowledgeable here with us today. So I appreciate you taking your time.
Happy to be here.
Sure. So I've been really excited to share this information with people. I say it's a secret that no one wants to keep. And so hopefully this will be a diving board to share this information. So what exactly is Trualta?
Yeah. So Trualta is a virtual caregiver education platform. We provide free 24/7 access to family caregivers on a variety of topics. And really what distinguishes us is we try to be so respectful of the caregiver's time, and all of our lessons are between 5 to 10 minutes because we realize that caregivers don't have a lot of free time, and we want to make sure that we give them really high quality professional level training in a short little segmented bite that they're able to digest.
That's wonderful. So can you be a little bit more specific in how it supports caregivers? What are you guys offering that might be different from someone else?
Yeah, so the portal, the way that it works, caregivers across North Carolina are able to have access, and they sign up with their name and their email address, and they can search and explore. It's basically like we've taken away the WebMDs and the Googling so that it is a safe, vetted place for them to get information about a variety of things. Some of the things are articles, some are videos. We've started doing some interactive activities. So say your loved one has challenges with dementia and they ask the same questions over and over. What do you do about that? On the portal, there's an activity that allows you to walk through, I think it's 4 different outcomes of the way that you can handle that. Some of them are good, some of them are not so good. And it enables caregivers to have a safe place to do that exploration so that hopefully if they do it in the portal, they don't have to do it in real life and have some of those consequences, like having an even harder, more stressful day. So it's all about caregiver education. There's also connections to local resources. For example, the Department of Health and Human Services, our partner with the portal, they've shared a lot of information about vaccinations. There's also information about the North Carolina Brain Health Registry, local support groups, all kinds of things like that. So it's kind of one-stop shopping for caregiver education and support in North Carolina.
Laura Jane, can you tell me some issues that caregivers are facing?
Yeah, actually, we hear a lot from clients. We're in 27 states, including Washington, D.C., and a couple of partners in Canada. We hear a lot, and especially over the last couple of years with the pandemic, we know as aging advocates and caregiver advocates, there has really been a spotlight put on some of the issues that we knew were more underlying even prior to the pandemic. But some of those things from big picture level, how we can work at better supporting families, ways to create sustainable solutions for some of the things that we were able to fund during the pandemic. And of course, it goes without saying, the direct care workforce shortage, finding really innovative, and not just innovative, but sustainable ways to address the direct care workforce shortage, which includes additional flexibilities for family caregivers. What we're hearing from some of our area agency on aging partners, looking for cost-effective, evidence-based solutions that speak to some of those flexibilities, integrating social determinants of health into programming. Again, it goes without saying that was important before the pandemic, even more so now. We saw during the pandemic just how vital a lot of those things like congregate, home-delivered meals, and the social interaction that they provided, transportation, all of those things really did create opportunities for wellness for older adults and caregivers. And then also during the pandemic, I think a lot of people realized just how prevalent lifespan, intergenerational, kinship caregiving circumstances were. So making sure that those caregivers are included in conversations and programming as well. So for the caregiver, bottom lines for them, they proved during the pandemic that they can and do embrace virtual supports. They really enjoyed a lot of the choice that was offered to them through some of those flexibilities that really did put them in the driver's seat more often. And it goes without saying, again, just planning for the unknowns, whether it be a pandemic, a hurricane, mudslide, whatever it is, just knowing that there is a plan for both them and their care recipient helps them sleep a little better at night.
Sure, absolutely. Absolutely. And I think a lot of times what people don't talk about is the cost that's associated with caregiving.
Mm-hmm.
Luckily during the pandemic, we were at home, and so we had some resources. But as we re-enter a more face-to-face employment again, we're really seeing that there's a cost associated with that. Are you finding that to be true on your end as well?
Absolutely. The cost of caregiving in North Carolina, there are 1 in 5 caregivers that provide unpaid support. And that is valued, according to AARP, at $7.15 billion. And there are about 500,000 caregivers providing care to an individual living with Alzheimer's in North Carolina. So there's a huge prevalence. And I think sometimes people don't realize just what the value of someone doing all of those things like medication preparation, supervision, all of the things that caregivers do every single day comes at a cost. And I think it's really important for people to realize that a lot of these caregivers are providing unpaid care, and 80% of care happens outside of a medical setting. So that's kind of what some of the thinking was initially for creating Trualta in 2017 was our CEO, he was working in the e-learning space, and he realized that there was this huge gap in caregiver education for unpaid family caregivers. They do so much work, they do so much for the economy, but there's not really a centralized, highly accessible place for them to get education and the training that they need to continue doing that safely and confidently at home. So that's kind of the connection between unpaid caregiving, cost of care, and Trualta.
Sure. Also what's unique about doing something online is that it's accessible 24 hours a day, 7 days a week. I know that you guys track a lot of what caregivers are looking at when they're accessing it. Are you finding that caregivers are accessing it in the evening hours or at certain times a day? Because as you said, most caregivers are working. And so, when they get home is when they start their second job as a caregiver.
It varies across our different instances, but we have logins from 7 a.m. to 2 a.m. And it really just depends on the caregiver and what they're going through. We know that a lot of caregivers log on to the portal while they're waiting at a doctor's office, while they're picking up their children and grandchildren from school, but also in the evenings when they've just put their loved one to bed for the evening, completed those evening ADLs, and have a few minutes to regroup. That's a time for them to kind of clear their head and think through what the next day's plan is going to be. And Trualta seems to be a helpful resource for that for some of our caregivers.
Wonderful. And it is a free resource, correct?
It is, yes. Through the North Carolina Department of Health and Human Services, the North Carolina Caregiver portal is accessible 24/7, and it is entirely free for all family caregivers in North Carolina. The beautiful thing about it is there is no app required. It is accessible. It looks the same. It functions the same if you pull it up on your cell phone, a tablet, your laptop, or your desktop. And most recently, I wanted to mention we have added a social feature that we call our Care Companions program. That is a virtual support group, and it works a little bit differently. There's a Trualta team member who does an initial introduction, coordinates all the logistics. We have created through research and subject matter input. We consulted people who have been doing support groups for decades to create our support group facilitation guide. So once that initial introduction is made, our staff members step away, and it's basically a self-sustaining support group. And we've heard really positive feedback, and 100% of caregivers said that they would like to do it again and that they're learning things. And and it's not super surprising, I guess, but just not one of those things that you think about a lot. One of the pieces of feedback that we got from the caregivers during the first iteration of Care Companions was it feels easier for them to talk to their peers who are in the same or a similar circumstance, because they don't feel like they have to be guarded. They don't have to filter what they're saying. They can just kind of tell it like it is amongst their peers. So we're really excited about this, and we're continuing to refine the Care Companions program, but it is another option for addressing social isolation and also giving some helpful supports, because the group facilitation guide ties back into portal content as well.
Wonderful. So what are some of the topics that are accessible for caregivers?
Well, I am glad you asked. We are working on continuing to refine our topics and our content offerings, but we really started with Alzheimer's and dementia, communication, dealing with difficult behaviors associated with Alzheimer's and dementia, and we've kind of grown from there. There's healthy aging, intellectual and developmental disabilities, stroke, diabetes, Parkinson's, and very soon we'll be rolling out heart health. And it's not just this is what it is. It's from a skills-based approach of these are the things that you need to know to take care of someone with diabetes. Or we find a lot of caregivers access us right after a diagnosis of dementia. So it's like, okay, you've been diagnosed with this life-changing diagnosis. What do you do about it? What's coming next? So we really try to take a skills-based approach, and our algorithms work so that caregivers who are interested in Alzheimer's and dementia content, that's what it's going to prompt them to next. They can go and look at a specific topic, but there's going to be 2 or 3 recommendations. Say you have another 5 minutes, take a look at this. So we really do have it tailored so that it is specific to the caregiver's situation based on what they select. We have a short quiz at the beginning when they first sign on, just to help with the triage process. Since it is on a self-registration model, meaning caregivers can go to nc-caregivers.com and sign up with their name and their email address. They're able to register themselves, but our quiz kind of works as a social worker or a case manager, walking them through, okay, what's going on with your caregiving situation? What do you find the most challenging? What do you know about it? And it comes up with recommended content specific for them. And there's a search bar if you just know that you want to talk about resisting care. It will pull up all things resisting care for you.
Great. So it's really easy to navigate.
Yes. And we have a panel of caregivers that our product and content team work really closely with. And we're always seeking additional feedback from caregivers, which is something I really appreciate as a caregiver advocate. Before I even worked for Trualta, having that authenticity of caregiver says, this isn't really working the way that you think it is. And like, it would be easier for us if you did blank. We're always taking those recommendations into consideration with caregivers. And our content is developed by subject matter experts, so it's clinically sound, but we really work to kind of find that happy medium, because ultimately we want to make sure that caregivers' time is not wasted and we're being as efficient and respectful in getting them the solution that they need as quickly as possible when they're on the portal.
That is something that's really impressed me with Trualta, is that it's not stagnant, right?
Mm-hmm.
So the topics are constantly evolving, the information's evolving. Y'all are very responsive to what caregivers are asking for. And I think a lot of times when people sign up for online platforms around caregiving, it's just very, you only need to access it once to get all the information you need. Here, it's constantly building in new content, and that's been really impressive to me. And honestly, that's what I was not expecting that. So every time I talk to you, it's always like, oh, and we're doing this now, and this has been added. And it's almost like a living, breathing document. And I think that's why caregivers are finding it so helpful and engaging, because it isn't always the same.
Absolutely. And we're always doing research to make sure that anything that has come out about the way that adult learners learn, that we're trying to incorporate that into the portal, the feedback from caregivers, and then also our clients. Like area agencies on aging and state units on aging and local aging service providers. We're always listening to what you're telling us when it comes to, we see a gap here. It would be really cool if you could add this. It doesn't just go into the nowhere. We have a detailed map and a plan for what's coming on the horizon and what feedback our clients and caregivers have given us. I wanted to mention along those lines, I forgot when I was talking about our topics and conditions, we have added feature to our to the way that we learn. There are 3 ways that caregivers can learn on the portal. One is through a module, which is an individual lesson on a specific topic. Then there are courses, which are a collection of lessons around a certain topic, for example, brain health. Then we also have added toolkits, which are they're broken up into 4 different tabs. And the first is an introduction, like an overview of, say, communication challenges. Then it goes, the next tab is a little more targeted, and then the final tab is very specific. And it's all skills-based. And within those toolkits, we have started launching Spanish content. So for caregivers in some of our Spanish-speaking communities here in North Carolina, we hope that will be helpful in allowing them some additional access as well, because we're always trying to make sure that we're serving all of our communities.
So, Laura Jane, how do caregivers access Trualta? What does it look like?
Well, I am so glad that you asked. So it is nc-caregivers.com. This is the login page that caregivers will see when they arrive at nc-caregivers.com. And there are 2 options. But before we do that, I want to scroll down and show just what the full landing page looks like, so caregivers know what they're signing up for. So this is a quick little intro video that caregivers can click on, or anyone that's North Carolina Caregiver Portal curious. They can watch a quick little video, and it will basically condense everything that we've discussed in the last 10-15 minutes into a quick 1-minute video. And there are a couple of caregiver testimonials scrolling down here. These are actual quotes from caregivers on the portal. Of course, the picture and name have been anonymized. So this is our onboarding experience. So statistically, across all instances, about 95% of caregivers want to customize their content just because they're there, they want to learn, they probably want to learn about something specific. So customize your content. So this is asking what topics are the most relevant. So let's say I am in a caring situation and I am caring for someone who has diabetes, they're older, and they have also recently had a stroke. And this breaks it down to the task level. All right, so that's what your caregiving circumstance is. What specifically are you wanting to learn more about? I want to know about mobility, bathing, and dressing. And are there any particular healthcare issues that you're concerned with as well? So given that my loved one has diabetes, I want to make sure I understand skin. I want to also understand if they go to the hospital, what my options are, what I need to know as a caregiver in the hospital, and physical changes. So I'm submitting this, and then our algorithms are creating a dashboard for me.
Oh, wonderful.
So this comes up with some of the recommendations, and this is what caregivers see when they are on the portal. And say your caregiving circumstance changes or you kind of want to just target down, you can always edit your topics. But let's take a look at transitioning from the hospital to home. This is a newer piece of content for us. So you'll see that caregivers can always look just below the title and see the time frame. This is 5 minutes. So we always align that expectation of what a time commitment is for a caregiver so that we're being as respectful as possible. We have created the portal to be readable from a 5th grade reading level on for literacy inclusivity. And you'll notice that caregivers have the option to use this audio player function, and someone can read this to them. We get feedback from caregivers that this is helpful, like while they're preparing a meal, they can listen to it, or while they're out for a walk, listen to it like a podcast.
Right.
But you'll always have learning objectives because we do take a skills-based approach. These are the skills that you can expect to learn from this 5-minute lesson. And this just walks through the circumstance of a care transition, which is such a common thing. So
yes, it is, unfortunately.
Absolutely. And I'm so excited that we have this content available now, because this is really providing some practical tips for when someone is admitted to the hospital, when they're in the inpatient setting, and when they're discharged home, some questions to ask. And really the goal here is caregiver self-advocacy so that they can learn how to be a voice for themselves and really ask those good questions that will ultimately set them as well as their care recipient up for a better outcome in the end. So these are some examples of questions to ask, both from the patient or care recipient perspective and the caregiver perspective. And then this section down here, particularly if it's recommended by the hospital that they go to another care facility, whether that be a rehabilitation hospital, nursing home for short-term care, or something long-term like an assisted living placement. These are some of those key questions. And we know a lot of people are tactile learners and just like to take notes on things. So we have this available in a PDF. And I can see a lot of people that I have encountered during my career. I can see them printing this out and making notes for these little questions to remind themselves to ask during some of those discharge planning meetings and things like that. And then caregivers can mark this as completed, a nice little check done, or caregivers have the option to check their learning. We know some people want that additional reinforcement that says, I took a quiz, I know what I'm talking about, but we really try to build the quizzes from a place of, and they're short, they're like 3 to 5 questions. We really try to build the quizzes from a place of like testing the skills versus testing a concept, just because we want that broad applicability.
Sure. Is there a way for caregivers to share this information with family members?
Yes. I'm so glad that you asked that. So we have this option now where if you go to the top and select learning, and you see our 3 different kinds of learning: courses, toolkits, activities. And then down here, we have a favorites. So say I'm reading through this as my mom's primary caregiver, but then my sisters take turns on the weekends. My sisters also need to know about diabetes care, and maybe I found some of the activities and recreation pieces really helpful too. So on these course cards, you can select, and this is favoriting it. So when my sisters come, they will have all of the things that I have flagged, the things that I have felt meaningful for them. So that's one of the ways that caregivers can share with other people on the care team about what they're learning on the portal. Caregivers, other caregivers within the same family are certainly able to sign on to the portal as well and have their own curated experience. But we find a lot of families are using this favorites feature or the download and print. If there's something that really resonates, printing those out and having that as part of the care instructions for the weekend is really proving to be effective as well for some families.
Well, that's a really great idea. I also thought, most of our caregivers are pretty tech savvy, or because unfortunately, younger adults are becoming caregivers. And so when you showed the PDF, I was like, well, I could always just save it and then send it
Yep.
to my brother or someone like that to share some information about it. So this is great. So just to reiterate, there is no cost to this, correct?
Correct. The cost associated with the portal is covered by the North Carolina Department of Health and Human Services. There is no cost to family caregivers in North Carolina.
Okay. It's accessible 24 hours a day, 7 days a week on multiple different platforms, or I should say. So even if you have a smartphone and you have access to the internet, you can use this. I would need a email address, which thankfully to the pandemic, most of us now have.
Yep.
There are ways for me to either listen to it, to read it, or to save it and revisit it again. All right. Is there anything else that you think I should definitely know about this? It's also I asked you that, but I'm going to say one other thing. I have found this platform to be very intuitive, which I think is a problem a lot of times for folks, is that it just doesn't make sense when you're navigating it. And so I would just like to say I have found that it's been intuitive. Is there anything else that you would like to add?
There's one thing, and I know I mentioned earlier, we're really hearing from caregivers that they're trying to be more proactive and get plans in place for emergencies, whether that be an emergency for them or their care recipient. I want to show y'all our emergency preparedness toolkit.
Wonderful.
You can just go to the top and select emergency planning, and it will pull up right here, emergency planning workbook. And this is a printable tool, and it just walks through what is an emergency plan, how can families use this. And this is a really helpful way to just get organized if you're new in a caregiving situation. It starts with information about the care recipient, who they should contact, some of their medical information, medications, medical history, personal preferences, and I think particularly for individuals with a cognitive impairment, this could be really helpful in an emergency where their routine has been disrupted, and knowing what some of the things that are fearful to them, some of the things that bring comfort to them can be really helpful. And just a schedule and details about medical equipment and aids, and organizing those important documents. And this can also kind of spur a conversation around some of those end-of-life decisions and medical decisions. And as a complement to this, we also have just released healthcare decisions toolkit. So I wish when I was a little baby facility case manager, I had this at a glance. And this is just a quick infographic style overview of the difference between healthcare power of attorney and financial power of attorney. And this is just all developed to kind of help be that one-stop shop for caregivers. But particularly, I think the emergency planning workbook, as well as this visual, can be really helpful for families if they are starting to have some of those conversations. So just wanted to point that out.
Yeah, no, that's great. That's really great. And again, that goes to what we were talking about earlier, where this is a living, breathing document or space, I should say, and it's constantly evolving. So if you log on once and go to log on again, you'll probably find that there's additional information there to support you. So it's definitely worth continuing to check back into it because, as you also mentioned, sometimes your caregiving, not sometimes, always, your caregiving needs evolve and things change, and your loved one may be getting better or they may need more support. And this is a great resource and tool to help you kind of figure out what your next steps would be as well as they start to transition. So thank you so much, Laura Jane. This is great information. One more time, what is the portal for people to log on?
It is nc-caregivers.com.
Okay.
And if you Google North Carolina Caregiver Portal, it'll also take you right there. And if they have any questions about access or anything like that, certainly feel free to contact your local area agency on aging or your local aging service provider, like Aging and Disability Transit Services, for those of you there in Rockingham County.
Thank you. As we wrap up, I always like to ask interviewees, what's your key piece of advice that you would give caregivers?
I think the biggest thing I would tell caregivers that were seeking resources and information is don't be afraid to ask questions, be persistent, and just keep asking questions. I know it's frustrating and it can seem very intimidating, but every single other person in your circumstance has had a question that they waited and didn't ask. And there's so many tools and resources available. Just be your own biggest advocate and don't be afraid to ask and be persistent, because the reality is the squeaky wheel gets the oil. So just keep asking questions and be persistent.
Wonderful. And if somebody would like for you to give this type of presentation to their church group or their social group, how can they reach you?
Well, I would absolutely love that. I can be reached. I have a super simple email. It's my name, Laura Jane, LauraJane, at Trualta.com.
Okay, wonderful. Great. And we'll also put all your contact information at the bottom as well. So thank you again. I really appreciate your time. And that's unfortunately all the time we have for today. We thank you guys for watching, and we hope you found this information beneficial. For more information on the different programs that we offer through ADTS, you can visit our website at adtsrc.org. Or you can always give us a call at 336-349-2343. We thank you again for joining us today. And remember that ADTS is here to help you and your family to age with dignity and independence in your home and community. Thank you.
Thanks for tuning in to At Home with ADTS. For over 45 years, Aging, Disability, and Transit Services of Rockingham County has focused on enhancing quality of life for individuals by empowering them to achieve optimum health and well-being, independence, and participation in community. To learn more about community-based services, resources, or how to help, visit adtsrc.org or call 336-349-2343.